Hi, Masini. How are you?
Hello, hi. I'm good. How are you? Good evening.
Doing good too. Was a bit of a busy day. How was it for you? How's the weekend going?
Oh, yeah, actually, my Saturdays are a bit busy actually. But yeah, I'm so glad we are doing this. I'm looking forward.
Yes.
And the
So
heat, I can't think straight with the heat.
it's it's the topic of discussion everywhere, and I really can't think about anything right now.
Yeah.
And difficult to think about how the kids we work with actually deal with this kind of uncertainties.
Yeah,
So
true. Actually,
difficult for us.
notice it has a lot of impact even on the clients that I see, irrespective of the age group. So since we're talking about it, it really like when on a cooler day, when it's not raining, how they are, and when it is a hotter day, and when it's like little gloomy, it really has a lot of impact. Temperature,
Absolutely.
yes, takes over. Yeah, but how are you though? How have you been other than just for the day? How is it?
Ah, all well, Manasini. I think excited for this session today.
Yes.
So I think we can get started.
Yeah.
Uh,
Yes.
so yes, would you like to go ahead,
Yes.
or
Thank
do
you.
you want?
Yes. Oh, so we are here today. Thank you all for joining in. It's so nice to see all familiar people who are logging in and being there. So Swati and I are here for our third live session. So our ideas, we both have expertise. I'll tell a little bit about both of us. If I miss out, you please pitch in and help, Swati. We both have experience working with ASD, and we have seen children who have undergone certain kind of therapy sessions, and we were there conducting therapies, and we have also seen it in adults. So as 2nd of April, and this entire month is about the awareness of autism, we are here to demystify what is autism. We hear a lot about it, and there are a lot of misconceptions about it, and I'm so glad at least there are misconceptions, unless like earlier there was no awareness at all. In a way that is good, but it was also creating a lot of uneasiness and a lot of unknown things that are out there. So we both here to just speak about from our expertise what it is, and the meaning of it. We will demystify it and help you understand it, and speak about what are the myths associated with it, and who are the professionals who come under it, and also what is the current scenario of it now. So earlier when we speak about autism, I think so it was not well much in the limelight. Now it has completely changed. So what is autism now, and what are the current statistics, especially in India and also the worldwide? And the last one is how we can be inclusive of this particular thing. So when we speak about it, I think so when we get into the myths, we'll get a better idea. So the inclusivity is something that I think so will really help us understand it better. So these are the three main agendas for the session today. But I think so we're looking hopeful for continuing more. Yeah. Yes. Would you
And
like to please tell your background first, Swati, before we start?
yes, so yeah, again, I been have been working with children on the autism spectrum, ADHD, learning disability, and other neurodivergent children, and it's been 6 years now. So been using a combination of different therapies, including play therapy, sunrise programs, teach therapy.
Mhm.
So a lot of parental coaching involved, and all the other stakeholders put together, trying to work as a team to bring about changes in the child's overall development. So that's my background, and have been working with school settings, clinic settings, home settings. So trying to understand the child in different environments.
Yeah.
So yeah, and I'm like really glad that I get to talk to you, because I know you have also been working with the children on the special needs spectrum.
Yes.
So
Yeah.
uh,
Yes. It was an
yeah.
initial my early career, if I have to go back. So that's where I started off with when I started using my behavioral theory of it. So I to get into too much and confuse and bore our viewers. But in psychology, there are different schools of thought. So, behavioral school of thought is what is generally involved when we speak about autism, basically. So, using that school of thought, which is a behavioral therapy, is what I started working with. Like you said, it was multiple setups. So, the setup that I was closely working was with their parents and in the school setups, and when they come to see me in the clinic. And we also were having an OT center as well. So, okay, we'll come into that. I don't want to start up all of
Yes.
that. So, different sectors basically, but the
Yeah.
sector I was working is basically to do with the parents. So, how can parents take them back and how they can work with them, and how we were working very closely so that they know what to do when they go back to a home setup and how it changes. So, we were working mostly on that when I initially started, actually. That was the main thing because there's no much awareness as 2-3 years down the lane. So yeah.
Absolutely. Okay, Manaswini, why don't you tell us why are you wearing that blue
Uh,
ribbon?
Thanks, you noticed. Yes. So this blue ribbon is basically to create the awareness for autism. Like I think so when we speak about ribbons, there are multiple things that are going around. So when we speak about autism, it's the blue ribbon. It's called Blue It Up, Blue It Light and things like that. And also there is a colorful puzzle thing. I think so that's what we mostly see, especially when we go and look for posters and all. So the colors, primary colors are what that are used in order to represent the spectrum and the change. And blue ribbon is to create the awareness. So yeah. And I see you're also with your blue curtain and your blue t-shirt. So thanks.
Yes,
Good for us to
accompanying blue. Yes,
yeah.
keeping the blue alive. So I think why don't I talk about, a little bit about the meaning of autism and, where does it stem from, right? So any questions also, viewers, you're welcome to ask and try to understand more from both of us, right? So autism basically is a neurodevelopmental disorders. When we say a neurodevelopmental disorders, we're talking about, difficulties or differences in the way the neurons are set up for a child with who is on the spectrum, which so we also use the terms like neurotypical and neuroatypical, which means that we are not saying something is wrong, but we are saying that a child with a neuroatypical brain is wired in a different way compared to a neurotypical brain, which is like maybe people like us. So it is not an incapacity or incapability to understand the world as such, but understanding in it a different way compared to what mass population does.
True.
So this neurodevelopmental disorder, what it actually causes eventually is difficulty or deficits with socializing abilities, understanding communication, like nonverbal gestures, intonations, taking cues with subtle cues from other people's style of communication and personality types. Also, this has to do a lot with repetitive behaviors or limited interest. So these are one of the common things that you will see with children and adults on the autism spectrum. So when we talk about spectrum, when we talk about neurodivergence, there are a lot of other disorders also which come into play. But today we focus only on autism. So yes, social deficits, communication difficulties, limited interest, and repetitive behaviors, intensive uh, you know, repetitive behaviors in a particular area only is what we see with children on the spectrum. So, Manaswini, would you like to add any kind of myths that revolve around the meaning of autism, or what people actually associate the moment parents get that diagnosis of the child has autism?
Yeah. So a little bit more about the meaning. So we also use these terms very normally called as ASD. So just to add on to that, it's autism spectrum disorders because things of spectrum you'll take us more further. So initially when we understood autism, like you were telling, it was only looked upon basically the social aspect of it. So from there itself, the myths came. So if a person is having social anxiety or a social phobia, immediately they would consider them as autistic. So socializing is one of the aspect of autism, but it does not alone tell that a person is autistic or have a neurodevelopmental concern. And another thing is that most of the people believe or have a myth that autism is something that can be inherited autism is something that is in your gene, or autism is something that can be cured with a medicine. I think so. And another thing that is going mostly around is that if people don't give me eye contact and speak, that means he is in the milder level of autism. And this is something that I hear quite a bit, and especially when children generally, like we were just initially speaking, because of the heat we all have tantrums, or because of something like I'm as a human, as a adult, I do also crave sometimes for sweet, and if I don't get it, I can get little cranky too, right? But we believe that if a person gets cranky, or if person is not able to contain themselves, that means they're autistic. So these sort of myths is what I generally hear quite a bit. Each time this comes up, I've been called out and I try to talk my bit, but the myths, I think so, are endless. This is something that I commonly came across, mostly to do with their socializing skills. If a person is struggling with socialization, that can be a main thing. Or if a person is really struggling with their understanding or memory, or being attentive in a classroom setup, or having any cognitive concerns, they immediately go to only ASD. Sometimes not all of them who are having academic related concerns can be that. It can be one of the aspect, but it's not the only aspect. Like you mentioned clearly, I would like to reinitiate that. I mean, like, just restate it again. It is your social, it is your repetitive behavior, and it is also to do with a little bit about your cognitive, which comes a very minor. Like an amalgamation of all is something that we kind of miss out on. So from there, I think the myths come. Did you come across any in your career and currently where you're working?
Uh, There are many, but like before I go there, I also recall something as to when actually autism was diagnosed initially.
Yes.
It was also to do with schizophrenia,
Oh,
like a child with, or a person with schizophrenia would
mm,
also have some similar kind of symptoms, and they were uh, labeled as autism, and it was, used interchangeably.
mm,
Now it is separated, and we see the spectrum of, average IQ, poor IQ, and high IQ among the autistic children and adults as well. And it is not that every autistic child is having an intellectual disability as well. So this is one of the biggest myth that I come across, that once you hear the word autism, it is associated with the child having difficulty to understand, difficulty to, be cognitively, progress, understand anything academically, or should not be put in school. So to tell out about, the spectrum, why do we call it as a spectrum, is because there is a combination of the IQ of the child and the severity of symptoms that they have, and based on these two factors we could tell how much can the child actually progress in school, and how often the child has such severe symptoms and has a poor IQ to actually do well in a school setting, or be able to take care of themselves. And so maybe they will need support from the family, from the society through their life. But it is not for every child. It differs. Some of the children and adults would need partial support, and some will not need support at all, given that they are having enough professional training, skill set that is being provided all through their life. So this is something that definitely the MR, or MR is the mental retardation, ID is the intellectual disability, which has been confused with autism spectrum disorders very often.
I think so. It's sometimes it's confusion and sometimes it's also the myths. These are like two intertwining things that can
Going
become quite.
hand in hand. Yeah.
And the
So
next,
I
when you told earlier that there are multiple, places that people work in, or the multiple professionals that are involved in it, could you please tell me, in your work setup that you have, who are the professionals who are there when we are speaking about that they're working together?
right. So when we work in a clinic setting, basically, so there are like behavioral therapists as myself, speech special educators, speech therapists, because we talked about communication difficulties that these children might have. We also have occupation therapists who will work on sensory issues. Earlier you spoke about how we are having such difficulty to deal with the temperature change and extreme temperature. However, you are expressing your frustration verbally and emotionally. these children may not be able to do that because of the communication difficulty. So we also call something like an introception where something that is happening inside of them, the hunger, lack of sleep, feeling pain, feeling, this temperature change, that may also cause a lot of difficulties, so sensory difficulties, which is being dealt by occupation therapists. So we do have neurologists, we do have pediatricians who all work in collaboration with one child. Again, I also want to specify each child will not need all of the therapists. Some child might need only speech therapy and behavioral. Some might need occupation therapy and speech therapy. Maybe there are no behavioral challenges that the child is facing, right? So some people, some children have difficulty to, use words, make sounds or use vocabulary. And on
Yeah.
the other end, there are children who have a lot of words but have pragmatic issues, or what can be stated as, difficulty to understand social cues and where to stop talking and where not to express too much. And, so they could be over expressive, if I may put it that way, not understanding social cues. So
Yes.
there are these spectrums, and based on that, different therapists would be working,
Mm-hmm.
like speech therapist, occupational therapist, behavior therapist, special educators, and parents are, I think, the biggest therapist, or biggest role that play in the child's life, because they're spending so much time with the child. The way they regulate their own emotions, the way they handle the child, has a big role to play, because the child sees them as an idol, a place where they learn most of their things from. So we do include parents as well as class teachers if the child is going to school, in order to bring about changes.
Um, One more thing I wanted to hear from you. So, what is the role of a child psychologist? So when you and me have initially started, I think so, child psychology, that entire degree or the specialization was much lesser. But now, in past 2, 3 years, I hear it more. So, what, according to you, can a child psychologist help when in situation like this?
So when we talk about child psychologist, we have like another 4 years of degree as such for child psychology separately. Now, when you talk about child psychology, they are not only specializing in assessment and treatment of children with special
Mm-hmm.
needs, like all different kind of special needs and developmental delays, but also childhood problems like, behavioral issues, wherein a child who is in the middle of parents' divorce, or going through certain kind of grief, going through a certain kind of abuse, be that physical or sexual, right? So handling children, understanding their mental abilities, and helping them deal through their big emotions, in keeping in mind that when a child faces trauma, they do not have enough words, enough emotional, like
Yeah.
vocabulary to express what everything happened. And sometimes it's expected of adults to give them that support, give them that vocabulary, give them modalities and ways to express themselves, art being one of them, definitely. So a child psychologist would actually cater to a little variety of issues, catering to the children.
And also another thing that I think as a challenge, and I'm sure even you would be facing, we have parents who Google these and come, and then they'll be like, A degree hai, A kya hai. There, I think so. It becomes a little bit more, you know, like where you have to differentiate, segregate, sit with them first, make them understand and talk. So that's why I asked you this question. So again, I want to just tell that in order to work with children who are in ASD spectrum or in other things, we don't have to particularly do child psychology as such. We can do general psychology and specialize in behavioral therapy or play
Play
therapy.
that.
Yeah. So I,
Absolutely.
yeah.
Thanks for clarifying that.
Yeah, and can we, I think so, talk a little bit about diagnosis? I think so. Everybody are an experts now. So thanks to ChatGPT and whatnot, he's not
Yes.
giving me eye contact. He's throwing tantrums in a supermarket. There you go, ASD. So how do we
Yeah.
diagnose?
So I think when we talked about the myths earlier, and how different symptoms that we see in school setting, in home settings, and like, all the tantrums that has been a major part in today's, like, kids these days. one place where you can definitely rely or go ahead with a lot of trust is government associated organizations, government hospitals, and getting your child assessed and diagnosed through a licensed psychologist who has
Yes.
either done an MPhil or has a license in psychological assessment or even a psychiatrist. So these are the people that you actually you should go ahead and trust their diagnosis, right?
True.
And we do not, when it comes to assessments, I usually send the clients or children parents who come to me also to a government recognized hospitals only, so that they can get those certified well,
Hmm.
because sometimes these maybe there are clinics in the smaller places where they might collect money, give you a certain kind of assessment based on one or two symptoms, but that is not how an assessment goes. An assessment is a very structured and intensive kind of questionnaire that goes about. The child is observed. A behavioral observation of the child is done. How they are behaving in different areas, how they are managing their frustration, how they respond to any kind of criticisms. How are they demanding things, and what are the observations of the parents in the house in different areas,
Yes.
right? So after analyzing all of these, you will get like a report which talks about the sensory profile of the child, what are the behavior differences that they are seeing in this said particular child and children of his age, right? So that will also help you to understand what is going on. So it is very important to get your child diagnosed only in a government recognized you know
And
institution.
I wanted to add a little bit on that. So we also, as the whole psychologist, we also have a Bible called DSM. So it's a diagnostic statistical manual. So that is also another thing that we generally use in order to do diagnosis. Already there are scales. And another important thing that comes under when we're speaking about diagnosis is, as per the definition goes, another thing that comes is their divided attention. So generally it says that when people are diagnosed with the spectrum of ASD, they find it difficult to give their attention to multiple things at the same time. I think so even you and me face that difficulty. It's not that, but the intensity of it changes.
Mhm.
So when they're focusing on one thing, even if you push them, force them, pull them, they find it difficult to let this go and start, or let this go and focus on another thing. So I think so even that is a little bit something that I wanted.
Need for compulsion
Yeah,
definitely is.
yes,
Yeah.
that
And
I think becomes very challenging. Yes, Swati,
so
please.
I recalled something while you were talking about, this divided attention. The newest concept that has come into picture is virtual autism. So now, what
Yes.
is virtual autism?
Mm-hmm.
It's at so with children from the age of 0 to 2 years, there are
Mm-hmm.
symptoms similar to autism which might be presenting because the child is exposed to screen time
Yeah.
way younger than they should have been. So,
Yes.
which means less amount of parental interactions, less amount of stimulation through the world around. Which means I see things fall and I try to understand what is gravity, or like I squish things and I understand pressure. I fall and I understand the depth perception. So all of this happened pretty naturally for
Yeah.
most of the children, in the previous generation, but right now it's so much of screen time. I have seen a lot of children during feeding time and even after that, right? Uh, like a maximum of 2, 3, 4 hours of screen time is present, be it in the form of TV or mobile phones and tablets. So there is a lot of passive attention that is happening, and then this whole process of scrolling through your short videos also has brought about the attention span
Being
into like
very
seconds from minutes.
true.
So all of this has amalgamated into something called as virtual autism. So
Mm-hmm.
it is important to understand that again, this is not like the autism which has actually been diagnosed due to certain genetic and behavioral challenges. This is something which has come because the child was not exposed to enough stimulation
Yeah.
to the world and was limited because of screen time.
Yeah.
So it is important to segregate both of these and make sure that uh, when it comes to screen time, a professional could tell how it is different from the actual autism. And the treatments would include reducing the screen time. And it seems like that's such a small thing, that small device, it has a very, very huge impact, because we're talking about the little ones and all of their neurons developing, their visual cortex is developing, their sense of listening, their sense of perception, understanding the world is just developing, understanding people, understanding, getting a sense of the world and how it works, the principles. And at that crucial stage, we have just cut down this whole connection with the world, and they are just hooked onto the screen time. So what
Want
is
to,
your view about
yeah,
this?
I was just about to say that that is very much true in a lot of way. But what happens is we immediately try to blame the parents or blame ourselves, telling screen is the only reason why they have autism. That's again not true. Even through screen, we learn a lot of things. Even actually through screen only, they know the rhymes better, they know the alphabets better. So, and also living in this age and generation, it's okay to be exposed to screen, but we need to understand how much we need to balance and how much do we need to take in a, like you said, in a day, 3 4 hours, 5 hours is a lot, maybe an hour or half an hour, so that they know how to use it, or they get used to this idea about it, so that we are not like depriving them of what is happening around their peer groups, and all of that is okay. But are we like giving that only that, and not encouraging them to be in a natural setup, is what I think. So it clearly plays a role.
That's
And
very
and
well put, honestly.
and another thing is that I don't think so autism alone it's there. No, it's a comorbidity. So when we speak about comorbidities, it comes with multiple other things, like how you have headache, then you start getting a throat pain, and then you start coughing. So how these all come together, I think so even ASD comes with a lot of other comorbidities. Could you please explain that a little, Swati?
Absolutely. So, like you said correctly, right? So, when we talk about a neural developmental disorder like autism, it doesn't come alone all the time. Very often, there are other behavioral issues and neurodevelopmental issues like ADHD or other learning difficulties and challenges. Not only that, but then there are physical challenges also that these children might, end up having, which means either some kind of apraxia, or having very less motor control, right? And also other disorders like Crohn's disorder, inflammatory disorders in their intestine area, or gastrointestinal issues, brain in like it's something to do with brain issues as well, wherein the child is not even able to express. A lot
True.
of time, where is the pain coming from? We might talk about, okay, child is head banging or hitting or throwing too much or crying. We do not know where is that coming from because of the communication issues. Is it because the child is having migraine? If is it because there is a lot of discomfort they're facing in in their stomach or in their back, or so all of this together also puts a lot of question into the entire spectrum of disorder itself. Ki, can we put all these difficult behaviors that children show as a symptom of autism, or is it because of the comorbidity? So what if we treat the comorbidity, all the other physical ailments and other issues, attention deficit issues, will the child feel better? And
Mm.
very often in few cases that happens,
Yeah.
right? However, it is not 100%, so we cannot put a finger and say, "Ki, okay, this is what it
True.
is." So yes, it's
Yeah.
still very, very ambiguous, and that's why it's been years and we're still at it.
Yeah. And also, what I generally see is they have a lot of gut related concerns, no? With the
Yes,
digestion or with
correct.
eating, specificity in only certain kinds of food, and how they want only that, and they're very adamant about it. So, I think so. Eating is where I see mostly there is a concern,
Difficulty.
or yeah,
Correct. Yeah, a lot of food allergies, right? So again, like when they're avoiding a certain food or wanting to eat certain food, we do not know if it is causing a certain inflammation. That's why they're avoiding it, or it's just a tantrum, you know?
yeah. And but
Uh,
we're quick, no, to just say that, oh, it's a tantrum. It's always this. They don't that this child doesn't want. Is always so stubborn. I think so that's where we need to understand it. Generally, autism comes with comorbidity of a lot of gut concerns, which they find it difficult to express, and there it comes with being adamant about their food styles or preferences. I
Exactly.
think so that's
And I think as a therapist, it's a learning for us also to keep constantly be so aware of, where is that issue coming from? Is it coming from a certain attention-seeking behavior, or is it coming from, certain physical aspects, or just the child having a difficulty? Even like, when it comes to temperature, I might be feeling very hot. I mean, if the child is feeling cold,
mm,
it he, the child won't be feeling entirely the way I am all the time, and the child will have difficulty to express what they're feeling. So we have to be so mindful and conscious when being around these children, and helping them to communicate better should be one of the first steps in order to help them through.
that's true. And coming to the current situation when we speak about autism, especially in India, so as per the papers that I was reading through and also the little research that I was doing, I'll tell first from my experience when in 2018 19, when I initially finished my undergrad and started with my career with this, I think so there were like centers in an area, one maximum. So that was the amount of awareness that we had, and that was the amount of help that was there. I think so now there is a competition in an area, at least 4 or 5 centers we find. So this shows in a way it's
Agreed.
possible that there is this much kind of awareness, and it's also a little scary how we are, as a society, as how the pollution and everything is having an impact on these things. So I think so that shows the rampant of this concern has become much more bigger, and also awareness is also becoming good. And as per the study, it said 1 among 100 are the people
Yes,
who are currently getting diagnosed, at least in
that is
India.
correct.
But yeah, again, maybe this also can seem overwhelming, but to be like honest and frank about this, I think so it's only the urban population that we're
Mm.
talking about. What about the rural population? And illiteracy is not complete in a country like India. So all these illiterate people and all of them are not diagnosed. I think so 1 of 100 is only the urban and the major cities, which they're going
Exactly.
seeking this sort of support. But leaving that, there are much more. And in a country like USA where there is more, it says that 1 among 36 are the people who are
That's a scary
diagnosed.
number.
It,
Yeah. So
but in a way, I think so we need to embrace ourselves and try to make it more inclusive.
be open to it, absolutely. And like when you talk about, the how this diagnosis may not be the accurate number, because we being in India, a country of villages, and so much of rural population, and within the urban population as well, we see that not every child is going to school, and few of these tests are also based on the cognitive developments of the child, and the child has never seen a thing, something like, hey, identify a particular item.
Mm.
And if this child has never seen that in his life, he's not going to be able to identify. So bringing these population into a clinic setting and trying to make those assessments, I think there are a lot of challenges, the practical challenges also, which come in. So either ways, the number has jumped from, I think, something like one of the researchers I was reading is saying something like, 1 among 2,000 to 3,000,
Mm.
and to now, like you said, 1 among 100 is a huge jump. And again, we do not know how much part of it is actually autism, and how much of a virtual autism has also stepped in and is part of that number. So
Yeah. Like
and
diagnostic current situation cannot, like, I'm just restating, it cannot always be the consistent and thing enough. Yeah, sorry, trying to say
so
something. Hmm.
So yeah, with all of the statistics, and knowing that now we have been having, people with autistic people in our country, in our world for all this long, we have adults with autism. So I have been mostly working with children on the spectrum. Very few, I
Yeah,
would say, who have been adults. So what have you had any experience, or have you read about it? What is your
yeah.
take on that?
Yes. So I am like based in Bangalore for people who are joining from outside. So when I was doing my training for counseling. So I started my career as working with children who had autism. Then I did my master's. Then 2 days I took a break where I wanted to train myself. This is the time where I started volunteering in a place. This is the first time I experienced people who are adults who had autism. So how we see children is very, very different when we see in adults. And especially these are
Definitely.
who did not undergo any kind of assessments or any kind of treatments or anything. So there it was quite intense. Maybe when it comes to their tantrums with food, or when it comes to tantrums with what they're wearing, even the skin sensitive is quite higher, especially in young children. Somehow it is very different. But the more adults they become and the more it is not being expressed and spoken about, the skin concerns become very, very difficult. So they're very particular only to wear certain materials, and the tactile thing is what it's called. So that is something that I've seen. And again, social clues. So when we speak about, I think so, I don't want to like take it away, but social anxiety, social phobia, and not being sensitive about social clues are very different. Somehow we put them all together and so not being sensitive with social clue and not understanding that in a setup like this, I shouldn't be doing this in a setup like this. Again, through that, we're not trying to bring in a military regime or something, but in a certain social situation, it's expected you to be in a certain way. Again, like I tell, it's not like it's trying to control you or something. So that's where a confusion happens. So that kind of social clues is what I seen in adults, which is a concern. So this is the observations that I. But when we speak about, so what do we do? How are they going to go? It is absolutely fine. They're cognitively doing very well, and they are able to work on themselves very differently, and they have occupational coachings given, vocational trainings given, so they're able to work on themselves, earn money, and they are doing the best that they could. But again, there are certain challenges, but if they were provided therapy from a younger age, where they would be right now could be very different. So that is little bit. And definitely there is a lot of hope when we speak about autism. First of all, the way we understand the term itself is like they're not capable of that, they're not capable of that. I don't think so that is the concern here. It is that they think differently, and they process differently, and they identify certain things differently. So that is where we need to
Yeah.
get into and understand that, you know, not like, and I think so. I'd like to quote one movie before we go ahead. Movie, no, series, The Good Doctor. I think so. Most of our viewers would be knowing about it, and that is definitely true. As much as my degree and I took my DSM, I took all my experience. Each and every scene that was shown in it was not fake and was not just for the movie purpose. So I think so that can help understand
People
better.
understand. Yes, absolutely. So, like you said, right, it is so positive to hear that even once they have become adults, it's not that, every person is going to need help. They are doing really well in the society. And as long as, the IQ and cognitive skills are intact, they're able to do things differently or, very often do things better than other people because of the limited interest that we spoke about. And once they are engaged in a particular interest, there is a repetitive behavior which acts as an advantage because of so much of practice that they have gained in one particular area as such. And this
Yes.
is also from the experience of the adult client that I was dealing with. So yes, they are doing really well in their area. It's that's just not maybe following all of the norms that we want, and like it's go socialize, go party, go people pleasing and all. That is not what these people would be actually standing up for.
Yeah,
So
it's nice. No, we can cut down all nonsense and focus only on something it's important. I know I could sound a little rude by saying that, but I'm just telling the benefit of it is, and also I don't know how much of it is true. I've read multiple articles. It says that Einstein was also undergoing certain symptoms of ASD, right? But because of
yeah,
that, we
and
yes, a lot of learnings now. So in a way, it was good. No, we're like able to switch off the unnecessary things and focus on what is more important. I think it's actually a blessing in a way how we can have like undivided attention. Now, though I'm speaking to you, to be very is there'll be like lot running. I'm able to hear the music in the background. That's I'm like, what are they watching? And I'm like, oh my God, is it light good enough? So much runs, but I think so they can naturally switch it off and focus only on one thing, which is amazing.
With the whole tunnel vision also that we talk about, when we talk about children with autism. So
Yeah.
I think that along with that, I think it becomes important to talk about what are the governmental policies that has come up within India for
Yes.
children with autism, and like was researching before coming to the live as well, and it talks about so many changes that has been brought up in terms of bringing regulatory boards to accept children with neurodivergence into schools, providing trainings to the teachers to work with children on the special needs, and bringing in more special educators into the school system, making it compulsory to have a counselor in the school and have a special education department in the school, making available occupational or vocational trainings for people with disability, be it physical or mental disability, trying to provide those kind of vocational training, occupational training, as well as giving certain quota to what we can say, the governmental jobs for these people, right? And as I speak, these are all the policies that I'm talking about, and we do not know how much of it implementation is being done. But
Yeah.
when we talk about the supporting factors, or when you also have been working in the field, I think we've definitely come across a lot of NGOs and individual organizations who have actually pushed the schools or organizations to work in the area of helping children with special needs, or helping children with autism, and providing vocational training, advocating their rights, advocating education for them. And I think one of the government policies also education for all, and uh, you know within that they're also talking about how every special child is also deserving of education, which should have always been the case, but it happened very recently. So yeah.
Yeah. And when you were talking, I was thinking about this one place that Asha School of. So maybe listening to all of this, if our viewers or anybody is interested to understand this and work, Asha is one of the places which is there in Bangalore, Asha School for Autism. Maybe you can go volunteer there, understand how it works. And also another thing that it comes across mostly is all these multinational companies, MNCs and all, they have something called as a CSR policy, corporate social responsibilities. I think so even they are investing a lot into this, going and doing some trainings or being, volunteering in these places or providing any sort of help that they
Mhm.
could,
Yeah.
and providing vocational training, funding. So it is getting much better. In a way, there is a lot of change, at least in terms of policies, but how much are we utilizing it? And as a society, how sensitized are we is something that we need to really think about. Is it
Yeah.
stuck? I think so. A little,
There's
no?
a little bit of internet issue, I guess. I can see you now clearly. Okay,
Okay,
so
yeah. Uh,
and
I was telling about
go ahead.
the inclusivity.
Correct. And as this goes on, it's also important to understand that we being in the field, or researching and talking, and through our networks, we come to know what are the different policies available. Sometimes there are parents looking for insurance policies also, because of the expenses that they have are so high when looking after a special needs child.
Yeah,
So the awareness about governmental policies, about the proper schooling systems, and maybe an NIS school where the child can opt for subjects where which they are comfortable with, without having to go through your typical reading, writing each of your English, maths, science, geography, history, language, and I don't know what not.
yeah,
So instead of going through all of that, all these options are available, and many parents are not even aware. So I think one of the things that is important through government is also the
yeah,
awareness of the policies
yeah.
for special
I,
needs.
I agree with you about awareness, definitely, Swati. And also, other thing is the shame. They hold on to a lot of shame. Why will my child go to an open school? Why is he or she any less? So, do you think this is a problem? Do you think that is a concern? No. And they force the child and they force themselves and try to live in for the society. I think so. That's where this session is why we are here today to make you understand that autism does not mean it's any kind of disorder, like it's a problem that we cannot include in the society and things like that. I think so. This is where we need to work on the shame, and we need to work on the sensitivity that is around it.
And acceptance.
Yeah, and acceptance, yes, the magical word, acceptance and then inclusivity. I think so that's where we, as a society, we make it difficult. I'm not going to blame the mother who's struggling. I've seen so many mothers, they go to jobs because they have to afford this, and also they force the child to go to multiple places and also to a regular school. I'm not nothing against regular school, but to be honest, with it's very challenging.
It is
Hundreds of
more
Oh,
challenging for us. Let's be honest.
oh my God. When people ask me, are you not getting worked up that you're old? I'm like, I'm very happy, man. I never want to go back to school. Like, seriously, that was the difficult era. I will any day be in a college, never back to a school. So
Right.
it is very challenging, especially in Indian setup and all this Narayana, e-techno, whatnot. I really think it's quite overwhelming. So that is where I was trying to talk about the inclusivity, where the shame that is associated, where how as a society we are not being helpful is what we really need to look at and need to understand it differently. Yeah.
So also to mention about, when you talk about inclusion, compared to few years back, we do have a lot of schools, at least in, metro cities and like, bigger cities, schools which are all inclusive, wherein we are talking about children were neurotypically developed as well as, neuroatypical child studying together. And when we talk about inclusion, it does not mean that you just include the child in the class, but everyone is being able to do the similar kind of activity
Yes.
but in a different way that they are able to like to give a quick example of, let's say, a child who's not able to hear, a child who's not able to see, a child who's not able to, maybe for the example, use hands, all of them sitting in the same room and trying to do a same activity in their own way,
Yeah.
right? Like, let's say, if it's a game of a cricket or watching a cricket, one person might just read like read the commentary somewhere, other person might just be seeing it, other person might like maybe I can't think of an example,
Yeah.
but okay, I got one. So for example, a child who has physical disability, right? And then we are playing a game of bowling,
Yeah.
right? So with the 90 pins or bowling, so there is one child who's on the wheelchair and rolling the ball while on the wheelchair. There is
Yeah.
another person who has, maybe muscular, weakness or something. So they can use an instrument to throw the ball.
True.
So, and still go ahead and play and have fun and be included.
Yeah.
A person who's not able to see has some kind of an instructions or, like braille, or a person who is having difficulty to understand any kind of instructions, either visual or audio, having a shadow teacher with them, which is another concept I think very important to share here for children who have little, the severity of autism is very high with symptoms. They could also opt for a shadow teacher to go with them in a school, and that is what we call inclusivity. That the child is able to do what other children are doing, but in the way that they can, right?
True. True. Yeah, that's
And
very
and of
beautiful. Thank you so much,
course,
Swati. The example and how you explained is like, I think so, viewers would agree with me, was really very clear how we can understand about inclusivity. Like you said, inclusivity means doesn't mean that we force and we put everybody together and give everybody the same thing. Catering to the needs, understanding the difficulties, then lowering it down a little bit or hiring it up sometimes. Sometimes and kids find it all this very boring, or they don't find it challenging or entertaining. That's where we need to make it more challenging.
yes,
Again, it's always the difficulty. Sometimes there are very high functional children who find all this
absolutely.
regular math very boring. They need already multiples of, like
Yeah, they
seven digit, eight.
need more stimulation.
Yes, yeah, they need more stimulation. So thank you so much. That explanation like really was quite helpful. Yeah.
So yeah, and with that, like I guess we also talk about these challenges, right? Like a child who is highly functional or doing really well in, let's say, math and having difficulty with the language subject for that matter, right?
Yeah.
It also impacts their self-esteem and understanding, because we're not saying the children don't understand; they understand in their own way. So when you are discriminating or putting them out or not including them in your play, this also adds to the self-doubt and poor self-esteem, and on top of them having difficulty socializing with others, there is this
This kind of
constant distance that they will create with other people, because they're feeling shy. They feel that the world hates me, nobody wants to play with me, right? So I have seen, I've come across children who are like beautifully wanting to play with other children. There are very cute ways in which they'll try, maybe throw a paper ball at someone else to actually express that, hey, I would like to play with you,
yeah,
but that happens when the society is accepting you. And that will happen when the facilitators, which means the adults around the child, is actually facilitating a child with a typical and an atypical child to play together in a
true.
way that both enjoy. You don't have to always be an expert in a game. It's
Yeah,
for having fun, and not just for the sake of winning and competition. Like that's what we'll do later if we want, right?
I think so.
So
When I think about this, it's going to like extend a lot more. But like you said, I would like to just conclude a little bit. And also, when we speak about the socializing difficulties itself, always, like you said, a buddy system works brilliantly. And also, when a child,
yes,
and some of the viewers who would be listening is like, but my experience with an autistic child was very different. I was being hurt, I was being scratched, I was. So we understand all of that, but unfortunately these children do not have a language in which they can communicate. That is why they're restoring to harming themselves or harming people around them in order to express a discomfort or even love. I have seen kids coming and pushing me and doing things like that. I would like wonder why is it happening. They're not able to tell that they want me, they're not able to tell that they like me, or they're not able to tell that come I want to play with you.
yes,
So they use these tactics.
that's the
So
way they communicate.
yeah, that's the way they communicate. I get it. It can be difficult, but few things like again we need to remember when we speak about inclusivity is being a little bit extra patient and empathetic. Just be human. Like honestly, I know it can sound difficult in this time and age when everything is running quickly. We are all restless. We all are running on time, but I feel like we're forgetting to be humans.
Yes.
I think so. Being human is more than enough to be inclusive of anybody or anything around us.
Absolutely. And as a society, it is our responsibility to take care of such children and adults to be, like you said, empathetic, kind to them, and a little more sensitive is
Yes,
all that they need
true,
to. And if you have difficulty understanding them, always ask,
true.
what would they like, and then go ahead, right?
And observe
Um, and
that.
and there is this saying which goes on, I think, in the psychology field. And if you know one autistic person, you know only one autistic person.
Yes, very
And
powerful. Yes.
which means that if you have had a certain kind of experience with one autistic person, does not mean every other autistic child or adult that you meet is going to be similar. You're going to meet a person who's like a amazing musician. You're going to meet a math a brilliant mathematician, or you might meet a person who's very socially awkward and wants to sit in a corner, not to be disturbed doing their own work. So it could look really different, and every child and adult will present autism in a very different way based on the combinations. Hence, we call it as a spectrum.
Yeah.
And when we talk about spectrum, obviously you do not have a structure saying that okay, har kisi ke sath yahi karo, or you do this thing and that thing only. So bottom line is going to be sensitive, be empathetic, be kind, be patient, ask questions to the
Mhm.
caregivers or to the autistic person itself that you meet,
True.
and that is how you can cater to them, and an autistic person if you ever meet. So yes.
Thank you so much. It was very beautiful learning the insights from you. I hear when we have casual talks, but this was extremely more insightful. And thank you
Mhm.
for me through the whole procedure. I really enjoyed this session
Same.
with you, Swati.
Yeah, it's always great to come in and have this discussion with you and like keep getting the perspectives back and forth. So thank you for being here on a Saturday evening with me. And I hope it was informative for all the viewers as well. Your questions again are very much welcome. If you want to understand more about help for people with autism, or want to understand more about autistic people, or you are someone who's working with a child or an adult who's autistic, do reach out. And there is a lot of help, lot of resources available compared to many years ago. So we are here for you, and thank you for being with us and watching us.
So much. So stay tuned. We are hoping to put up some more things about inclusivity and hoping to put up some more things about the treatment options and the management, how we can do better. So it's all going to come up. So stay tuned. But before that, you can keep asking us your questions or letting us know what you would like to hear from both of us the next time. So yeah, great. Have a great weekend then, Swati. Thank you so
Thank you
much.
so much. You too have a great weekend, and bye everyone. Thank you for joining us.
By hydrating in this well.
Oh
All of
yes.
you too. Please. Yes.
All right. Bye. Bye everyone. Bye Manaswi. Take care.